If you're turning 65 and still clocking in, meaning you still have your job, this is where Medicare enrollment can get confusing. You might be thinking, what do I do now? Sign up for Medicare and keep my job coverage too, or should I delay Medicare and just keep my insurance the way that it is now? Because keeping both can be pretty expensive. Why is this so complicated? Sounds familiar? I get it. The good news is, in the next few minutes, I'm going to help you make this decision fast and simple. By the end of this video, you'll be confident on either enroll in Medicare Part B now or wait a little bit longer. By the way, my name is Amis. I make simple, easy to follow Medicare videos to help you understand your options. So when it's time to receive your benefits, you can do so with confidence. By now, you've probably heard that Medicare has different parts. Yep, Medicare is a whole system, and we'll break that down in another video. For today, the goal is simple: help you make the right healthcare decision without the confusion. But before we do that, let's quickly go over Part A and Part B because they relate a lot to this topic. Part A is your hospital coverage. This is what helps pay for inpatient hospital stays. Most people don't have a monthly premium for this part. Some people might if they don't have enough work history, but most people don't. Part B is your medical coverage. This one helps pay for doctor visits, outpatient care, tests, things like that. This part does have a monthly premium, and in 2026 is $202.90. Now, assuming you currently have a job, let's figure out your path with two quick questions. Do you have health insurance through your job? Your employer has 20 plus employees. If you answer yes to both questions, then you might be able to delay Medicare Part B. Now, maybe that's not your situation. So let's switch things up a bit. Yes, you're still working, you still have your job. Yes, you have health insurance through that job, but your employer has fewer than 20 employees. If that's you, the rules change. In most cases, you shouldn't delay Medicare Part B. If you do, you could end up with a late enrollment penalty that can stick around for a long time, and you don't want that. You might hear the term creditable coverage. Quick note on that, that term is usually used for Part D prescription drug coverage. But for Part B, the real question is simpler. Is your insurance coming from current employment? Meaning you or your spouse are actively working and you're covered through that job. What that means for you is if your employer has 20 plus employees, the employer coverage usually pays first and Medicare pays second. In many cases, that's when people can delay Part B without a penalty. Now, if your employer has less than 20 employees, Medicare usually pays first. So delaying Part B could put you at risk. This is why it's so important to ask the right questions and get official information from your HR department. Don't assume, don't rely on coworkers to feed this information to you. Get it from the right source. So now, let's say that you don't have a job, but you have some sort of health insurance that's not Medicare. And I'm sensing danger because just having some sort of coverage other than Medicare is not automatically enough to delay Medicare Part B. Perfect example, I had a client who thought that the marketplace would be a better option and never enrolled around his initial time. And now he's facing a late enrollment penalty. Just so we're clear, you guys have a 7-month window around turning 65 to enroll. That's plenty of time to do what needs to be done. But also 7 months can fly by really, really fast. And if you're not sure about your options or your decisions, please ask questions. Now, here's the key. If the coverage is not tied to current active work, yours or your spouse's, it usually does not protect you from Part B penalty if you delay. Let's talk about COBRA for a second, because this one can be a little tricky. Now, COBRA is a law that lets you keep your employer coverage after an event like leaving a job. But COBRA is not covered from current employment. It's temporary. So COBRA usually does not protect you if you delay Medicare Part B. That's why people get caught with penalties. Let me give you a few real-life examples so you can see yourself in this. Maria is turning 65 in 2 months. She still works full-time and her job insurance is pretty solid. Maria might be able to delay Part B, especially if her employer has 20 plus employees, but she should confirm with HR. Mr. Joseph turned 65 last month and he kept his coverage through COBRA. Again, COBRA is not active work coverage. So Mr. Joseph should not delay Part B thinking COBRA is good enough coverage. When in doubt, ask questions and to the right people. Here's your simple homework after this video. If you're turning 65 soon, have a conversation with your HR department. You want to know if your current health insurance is considered coverage from current active employment. The answer will tell you if you should delay coverage or not. Now let's recap what we've learned so far. If you have insurance from active work, yours or your spouse's, you might be able to delay Medicare Part B. If you're not actively working, you should not assume you could delay Part B without consequences. In the next video, I'm going to explain the rule that controls almost everything when you delay Part B. The 8-month clock, when it starts, and the mistake people make with COBRA. So don't miss that one because it can literally save you money. Thank you so much for watching, and I'll see you guys in the next video.